So today I will be discussing cholestasis of pregnancy and give you some more information on that. So intrahepatic cholestasis of pregnancy, commonly known as cholestasis of pregnancy, is a liver condition that occurs late in a woman's pregnancy. And the condition triggers intense itching, but without a rash, so you don't have a rash, but you are itchy all over your body. Some women just experience it in their hands and feet, so the soles of their feet and their palms, but it can also be all over the body. So this condition affects the normal flow of bile, and bile acids are chemicals in the bile of the liver that help with digestion. So with ICP, the bile flow begins to slow down. In turn, the bile acid builds up in the blood, causing the intense itching. The itching can be so bothersome that it will wake you up in the middle of the night. It is often worse at night, so that's when most women experience it. There's rarely jaundice with this condition, so not a lot of women that have this, you see that they will have that jaundice look. Although it has been reported as early as 8 weeks pregnant, it's more common in the third trimester, so 30 weeks and above. When hormone concentrations are at their highest levels, that's usually when these women start to experience the symptoms. The figure for the percentage of women for whom ICP will recur in future pregnancies is 60 or as high as 90% for severe ICP. So women who have severe ICP will usually have this condition again in their next pregnancy. So, according to Mayo Clinic, cholestasis of pregnancy can make you feel very uncomfortable, but more worrisome are the potential complications for you and your child. Because of the risk of complications, your doctor may recommend early delivery. So the intense itching is the main symptom, and there is no rash with that. Most women feel itchy on the palms of their hands, soles of their feet, like I said, but some women experience the itching everywhere. So other less common signs and symptoms of cholestasis of pregnancy may include yellowing of the skin, the jaundice, nausea, and loss of appetite. So there's really no cause of this that doctors are aware of currently. Your genes may play a significant role in this. Sometimes the condition runs in your family, and certain genetic variants have also been identified. So pregnancy hormones may be involved. So pregnancy hormones rise closer to your due date, and doctors think this may slow the normal flow of your bile. Instead of leaving the liver, bile builds up in the organ. As a result, bile salts eventually enter the bloodstream, which can make you feel itchy. Overall, 1 to 2 pregnancies in 1,000 is affected by ICP. And these usually occur in Latina populations at 5.6%. Women carrying multiples and women who have had IVF treatment also appear to have a higher risk, and those who have had previous liver damage or issues may be more likely to develop this condition. There is a higher prevalence in Scandinavia and South America populations, specifically Chile, where the reported prevalence is as high as 15.6%. And mothers and sisters of patients with this condition are also at a higher risk. So when being diagnosed with this condition, your healthcare provider is likely to think that you have cholestasis of pregnancy if you present with the severe itching. Lab tests will confirm the diagnosis. So you may have these tests: liver function tests, including the amount of bile acid in the blood. This test result will be high if you have cholestasis of pregnancy. Other lab tests, including prothrombin time, and this checks how well your blood actually clots. And you may also have other tests done, such as an ultrasound exam on the tubes that carry the bile. Some factors that may increase your risk of developing cholestasis is history of liver damage, being pregnant with twins or more, and personal or family history with this condition. So some complications that can arise from this condition. In moms, the condition may temporarily affect the way the body absorbs fat. Poor absorption of fat could result in decreased levels of vitamin K, dependent factors involved with the blood clotting, so that is not a good thing to experience. But this complication is rare, and future liver problems are uncommon. In babies, the complications are much more severe. They may include being born too early, preterm birth, Lung problems from breathing in meconium, which is something that should be in the baby's lungs while they're in the womb, but due to fetal stress will come out if the mom has cholestasis. And then death of the baby late in pregnancy before delivery, so stillbirth. Because complications can be so dangerous, your doctor may consider inducing before your due date. And despite the possible outcomes of ICP, proper treatment provides a great degree of reduction in both fetal risk and maternal symptoms. With active management that include the two most important factors in the treatment are reducing the bile acids in the bloodstream with a medicine called ursodeoxycholic acid and delivering the mother as early as 37 weeks, so as long as the lungs are mature, they will induce. In cases where bile acids do not respond to treatment, it may be necessary to deliver earlier than the baby's lungs may mature to protect the child from possibility of stillbirth. Unfortunately, there is still no cure for ICP, and most treatments are aimed to just relieve the itch for the woman who is pregnant. And some may also help protect your baby, as research has shown with UDCA. I was actually diagnosed with cholestasis late in my pregnancy, and my diagnosis was not as severe as other pregnant women may experience. I actually made it past 40 weeks without any complications, which I am extremely grateful for. I did experience the intense itching, unfortunately, from 34 weeks pregnant until I gave birth. The itching was so intense it would wake me up in the middle of the night, and my doctors did tests to check my bile acids, and they would fluctuate, so they ultimately decided to induce. So in conclusion, cholestasis of pregnancy continues to be treated expectantly despite its association with increased disease and death, and evidence suggesting improved prediction with active treatment and the potential of reducing the associated perinatal death.